Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Welcome back again. We will be talking about chelation therapy. So one of the things that we do here at clinic or at the center is we look at your toxicity load. No, we also try to assess how much toxin is in your body. No, so there are several ways to check our toxin levels. No, usually we check your blood. We can also check your hair. We check your urine for what we call heavy metals, no? So what are heavy metals? These are metals that are, in the environment, no? Yung like aluminum, mercury, arsenic, lead, cadmium. So these are all in the environment and we are constantly exposed to them, no? Especially those exactly like those who have tawag nating mercury amalgams, yung mga pasta, no, that are color black or silver. These are mercury, no, so they are very toxic, not only to the entire body, most specifically to the brain, no. It affects these heavy metals, the mercury heavy metals actually go into the nervous system, no. That's why if are not aware, no, bawal na, it has been prohibited to use mercury amalgams, no. Now if you do have mercury amalgams, I do suggest you have it removed if possible, no, because this is added exposure to you, no. And a lot of people, we see a lot of patients with mercury amalgams who later will develop either cancer, Parkinson's, some strange weird neurological disorders. So usually these are people who have sometimes high levels of heavy metal, specifically mercury, no. Now other heavy metals like aluminum, of course, if you drink a lot of sodas from aluminum cans or you cook in aluminum cookwares, you're exposed to aluminum. Those who are smoking, like those who smoke cigarettes, so these have high levels of cadmium, no. So that's also one of the things that we have to consider, as well as those yung mga may lead, no, especially during the early years, no, when gasoline was still leaded, no, tawag natin leaded gasoline. A lot of people were exposed to lead as a heavy metal because lead is like mercury, affects your nervous system, specifically your brain, no. It can cause a lower IQ, especially among kids, no. So we really have to be aware of our exposure to toxins. So aside from brain issues, what does heavy metal do to the body? Actually, it can also cause kidney diseases. It can also cause hypertension, no? So a lot of people who have what we call resistant hypertension might have high levels of heavy metals, specifically lead and cadmium. So these are things that we assess, and if we do find out that they have high levels of heavy metals, one of the things that we can advise is to do what we call the chelation therapy, no. So there are many forms of chelation therapy. When we say chelation, we're actually trying to remove that specific heavy metal. So it could be either oral or IV, depending on the type of heavy metals, no. I'm sure some of you have already heard of what they call chelation therapy. Is one way to remove heavy metals, specifically lead and cadmium, no. This chelation is done through IV because orally it's not absorbed very well, no. But there are other chelators or heavy metal chelators tawag natin that are effective orally. So this is what we call the DMSA and DMPS, no. So DMSA, DMPS are more appropriate for those who have high levels of mercury, high levels of lead also, and arsenic, no. So we can do several types of chelation therapy depending on the type of heavy metals that is present in your body, no. So guys, if you have a question with regards to heavy metals, kindly do send them here. We will be gladly to make sure we're able to answer them, no. One of the things also that we do in patients with cancer, they are also exposed to a bit of heavy metal. So one of the things that we do, aside from giving vitamin treatments for those who have cancer, we also do some chelation therapy, especially if they already have history of exposure to heavy metals or they already have heavy metal amalgams. But of course, before we do chelation therapy, we have to make sure that they are, they have gotten rid of the amalgams, because of course if you have amalgams, then no use in doing chelation because it's still there, so you'll be wasting a bit of money doing chelation if you still have the heavy metals, present in your body, no? Other sources of heavy metals that you might not be aware of is those who have what we call mga prosthesis, those who have done hip replacement or knee replacement made of titanium, no? So this titanium over the years nagwe-wear out din, no? So it can also accumulate around the tissue as well as in the blood. So these are some of the sources of heavy metal toxicity that you have to be aware of, no? Now I will read some questions from our listeners and answer them in this segment. Miss Mai said, can you use natural chelation products? Yes, you can, but they're not as effective. But yes, you can use either what we call cilantro. There's also chlorella. You can also use spirulina. Some also advocates the use of other vitamins such as vitamin C, alpha lipoic acid. These are also, they're good. I mean, they're weak chelators, no? Weak chelators. You can also use activated charcoal, especially in patients who have amalgams. If you have amalgams, you're 24 hours a day, 7 days a week, every second is exposed to that specific heavy metal. So one way to avoid, ingesting and absorbing the heavy metals is to take activated charcoal. Okay, so I hope this session you kind of learned something new again today. So this is chelation therapy. So if you do have questions, we can answer them for you. Hopefully you learned something today, even if it's a small thing. And again, just to remind everyone, because of this COVID pandemic, to keep your immune system strong, okay? It doesn't matter if you are surrounded by COVID positive patients, okay? As long as your immune system is strong enough, the chances of having an infection or becoming infected becomes lower, no? A lot of people are, you might not be aware, but in patients or in households wherein one family member have been shown to have positive in COVID, by swab test, then they find out that the other family members are never infected. So it's really not just about, taking drugs. It's also trying to make sure that we improve our immune system, no? So Miss Geraldine's asking, how long can we take EDTA? It depends, no? It depends on the type of heavy metals. It depends on the how long, you've been exposed to it, or how well do you feel. So one of the things that we do check is we also check again your heavy metals after a certain period of number of chelations. We repeat a heavy metal analysis, or if we see that patient is getting better, or no more symptoms or sign, then we can usually stop the EDTA chelation. Okay, thank you for that question. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health, or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.